Let's take you now live to a media briefing. KwaZulu-Natal Premier Sihle Zikalala is currently giving an update on COVID-19 developments in that province.
You are aware we are in a period where we are undertaking an intensified campaign on no violence against women and children, including gender-based violence and femicide. In KwaZulu-Natal, we are rolling out a 365 days campaign. We therefore call on all citizens to take a stand and say, enough is enough, sekwanele. It is time for all of us to stand up and end this pandemic that brings so much pain, suffering, and shame on our society. We recently launched the program of action on no violence against women and children and femicide campaign in the province last week. We will therefore be scaling up interventions aimed at protecting our women, children, and the vulnerable in our society. Our campaign is grassroots based, and all MECs, mayors, councillors, and amakhosi are leading programs at local levels and integrating them in line with the district development model. We refuse that our province be associated with violent crimes, especially contact crimes and the dehumanization of women and children. We will take the war to criminals and perpetrators of violence against women and children. We have mobilized law enforcement authorities and are encouraging society to speak out and not suffer in silence. It is often said that for evil acts to succeed, it is because good men and women keep quiet. We must act in unity to prevent and ultimately defeat this scourge and create an environment where women and children are free to exercise their choices without the fear of being abused or attacked. Winning the battle against this pandemic will take nothing less than all of us working together. As the province of KwaZulu-Natal, we are waging war against gender-based violence and femicide, not just for these 16 days, but for the next 365 days and beyond. On Tuesday, the 1st of December, we will join the rest of the world in commemorating World AIDS Day under the noble theme, and I quote, ending the HIV and AIDS pandemic, resilience and impact, close quote. This is a profoundly important theme. It tells us that through our ability to face up to incredible hardship and persevere, we can conquer and prevail under very trying conditions. Given where we have come from and the devastation that HIV and AIDS used to cause in our society, the fact that today we are even talking about the possibility of ending this pandemic is nothing short of a miracle. While World AIDS Day is an opportunity for us to remember solemnly all those who have passed away due to this pandemic, it is also a chance for us to appreciate all the scientific advancements that have been made to weaken the impact of HIV and AIDS globally, which was once an unstoppable pandemic. It is also an opportunity for us to take stock of the journey that we have traveled as a country and a province, and to further accelerate efforts and programs that are aimed at wiping this scourge from the face of our society. On Tuesday, our entire provincial cabinet will visit all the 11 districts of KwaZulu-Natal to engage with communities in commemoration of the World AIDS Day. We will unpack the progress the province is making. We invite all citizens to observe this day and renew their commitments toward creating an HIV and AIDS-free generation. Building stability in the road freight sector. On Friday, the 27th of November, we held an emergency meeting with key stakeholders in the trucking sector as part of effort to bring stability to this critical sector of our economy. The engagement follows recent disturbances on our major national highways, where trucks were burnt and drivers attacked in a long-standing dispute over the employment of foreign nationals in the trucking industry. We reached important commitment which we believe that if they are implemented successfully will guarantee peace and stability in this all-important industry. In principle, we agreed that the truck operators must with immediate effect prioritize the employment of South African drivers. We will soon, together with national government, mount an intensive operation along N2, N3 and N11 route in KwaZulu-Natal, targeting drivers without proper permit. Every foreign national who is currently driving a South African registered truck must be appropriately licensed and hold a valid permit issued by the Department of Home Affairs. The Department of Home Affairs work permit is only issued upon offer of employment by the prospective employer in South Africa. In the meantime, the truck operators have committed to providing at least 400 new jobs, and these will prioritize South Africans. We will engage with the Department of Labour and Employment to manage the database of the prospective drivers, which will be submitted by driver associations, including the All Truck Drivers Foundation and the National Drivers Federation. The department will also verify the drivers' database, ensuring clear criminal records and validate qualifications. We now have a firm commitment from drivers that there will be no banning of trucks or blocking of any road or entry to the port. At the same time, we expect the Justice, Crime and Prevention Cluster, Crime Prevention and Security Cluster, not to abandon their core responsibilities, which include enforcement of the law. And that must be done without any hesitation whenever this is required. We agree that these are stopgap measures. The long-term solutions include effecting appropriate amendments to the law. Therefore, our proposal to national government includes speeding up the review of the scarce skills policy to clarify the contentious question of the employment of foreign nationals in the low skills sectors. For this reason, we have escalated the matter to the national government, as this is not only a KwaZulu-Natal matter, it has an implication for the entire country and the entire SADC region. Our provincial government is fully committed to the transformation and stabilization of the road, freight and logistic industry, which is a critical sector of the provincial and the national economy. We will work together with all stakeholders as long as they are prepared to find a lasting solution to these current challenges. The task team that have been assigned with the responsibility of addressing challenges in the road freight sector will meet weekly to receive reports on the operations. We wish to reiterate that we will not allow lawlessness to threaten our economy, and that we have no doubt that all our key stakeholders will play their role in this regard. Well, when it comes to the issue of the COVID-19, the trend analysis, moving on to the COVID-19 trend analysis, KwaZulu-Natal has had a total of 127,506 confirmed COVID-19 cases, with 6,212 still being active. Sadly, we have lost 3,340 people, while thankful that about 117,964 have recovered. As the province of KwaZulu-Natal, we are currently ranked the third highest countrywide after Gauteng and the Western Cape in terms of the laboratory confirmed cases. But we are ranked at number 4 after Gauteng, Western Cape and the Eastern Cape in terms of COVID-19 fatalities. Nevertheless, we are extremely concerned about the increase in the number of new COVID-19 cases in the province over the past 4 weeks. We are currently in week 48 of the year 2020. The actual number of confirmed cases in the week 45 was 765. In week 64, it was 869. In week 47, we had 1,134 cases. So this shows that there is a trend that is going upward in terms of the cases per week. Over the past week, which is week 48, the figures have jumped substantially to 1,652. The number of new cases increased by 30% between week 47 and week 48. Over the past week, the highest number of cases received on each day was 348 on Friday, 27 November. As of yesterday, 28 November, we had 287 new cases and no death. eThekwini continues to record the highest number of new cases daily and has contributed approximately half of the total laboratory confirmed cases provincially. In terms of fatalities, the number of deaths reported in the province has been declining in the past 4 weeks. The actual number of deaths reported was 18 during week 45, 23 during week 46, 17 during week 47, and 16 during week 48. The case fatality rate therefore remains at 2.6%, and the mortality rate was 30 deaths per 100,000 population. Amajuba and eThekwini district have the highest mortality rate and 40 deaths per 100,000. In terms of infected healthcare workers, a total of 7,132 healthcare workers have been infected with COVID-19 in the public sector since the beginning of the pandemic. Of the total infected, 88%, which will be 88 in terms of numbers, which will be 1%, have sadly succumbed to this disease. The majority of the infected healthcare workers were nurses, who made 58% of the number of infected healthcare workers. There are no new deaths. There are no new healthcare infections or deaths that have been reported as of the 27th of November. The readiness for the province to tackle the second wave, the province is monitoring the research indicators very closely and has not reached the resurgence threshold, although in the past week the number of cases have been fluctuating, with the highest number of 353 recorded on the 27th November. These indicators are monitored daily, and if the surge indicators are triggered, the provincial plan will be implemented. Distribution of cases and death by district between the 5th of March and the 28th of November, reading only new and the total number of cases. eThekwini, new cases is 156, and the total number of cases is 60,354. In Ilembe, 16 new cases. The total number of cases is 7,280. Mkungundlovu 13 new cases. The total number of cases is 17,014. Utugela 7 new cases. The total number of cases is 5,285. King Cetshwayo 7 new cases. The total number of cases is 10,757. Ugu 47 new cases, and the total number of cases is 5,497. Amajuba 3 new cases, and the total number of cases is 6,981. Umkanyagute, there is no new case, and the total number of cases since the beginning of the pandemic stands at 2,969. Hirikwala 18 new cases. Total number of all cases is 2,661. Zululand 7 new cases. Total number of cases is 5,100. Umzinyathi 4 new cases, and the total number of cases is 2,637. Unallocated it's 9, and the total number of cases is 971. That therefore brings the province to 287 new cases, with the total number of cases since the outbreak of this pandemic stands at 127,506. The deaths, the total number of deaths that we have experienced is sadly 3,340. And that means that rate in terms of the case fatality it's 2.6%. The district with a high magnitude of laboratory confirmed cases have contributed a high number of COVID-19 related deaths. These districts are Majuba, Ugu, eThekwini, Mkungundlovu, and Utugela. In the recent weeks, we have received reports of the following cluster outbreaks in the province. And these are University of KwaZulu-Natal, 47, one high school in Durban, 17, Ladysmith Correctional Service, 10, Chatsworth, 13, and there have been 2 deaths there. In terms of the field hospitals, we must report that the province decommissioned the Royal Shore Field Hospital in Pietermaritzburg. However, we must point out that if there is a need, we have the capacity to activate beds that were used during the first wave. In terms of the staffing, the department has also requested to extend the contract of the staff who were recruited for COVID-19 until March 2021. At the appropriate time, we will make an announcement regarding the outcome of this process. In terms of preparation for resurgence and the plan, we have developed a plan, and it is underpinned by basic actions that should be carried out when responding to the possible resurgence. And this action plan is based on track vigilance indicators, verify data and identify outbreak source, efficient and targeted communication with the community, increase screening and testing, intensify contact tracing, enforce isolation and quarantine, assemble a multi-sectoral team, and develop a content-appropriate plan. A festive season plan has been developed with the focus on risk communication and community engagement, and the clear message here is that we must continue with wearing of masks, hand and hygiene, which include washing hands and using sanitizers, social distancing, and that include management of indoor and outdoor gatherings, safety and responsible holiday conduct in KwaZulu-Natal, shielding vulnerable family members when coming back home or visiting family or friends, and engage with taxi owners, taxi drivers, and passengers on COVID-19 prevention, engagement with owners and patrons at taverns, nightclubs, as well as adherence to COVID-19 prevention interventions during weddings, funerals, church services, restaurants, and in all other activities. We will be having loud hailing at mass gathering and outside the beach, and these are part of the programs we have put in place as the provincial government. As we conclude, we wish the matric class of 2020 all the best with their ongoing final examination. We are aware of the many upheavals that they have had to endure during this time when there were disruptions caused by COVID-19. We commend them for remaining resolute and for having come this far. Both learners and educators will go down in history as the brave warriors who soldiered on in the name of pursuing education in spite of all the challenges that have been experienced this year. In the same breath, we want to assure the public that we are doing everything possible to safeguard and preserve the quality and integrity of these examinations by eradicating the risk of exam papers being leaked. As we have stated before, we will take the most stringent action possible against any individual who make themselves guilty of acts of fraud or corruption relating to the examination. They will regret the day they ever conceived such despicable and uncivilized thought. Again, congratulations and all the best to the class of 2020 for having come this far. We wish you all the best. I thank you.
Thank you very much, Honourable Premier. We are going to go straight to questions of clarity. And those colleagues that are following us online will indicate if there's a question. Can I see the expression of hands? Sheila, Dassen, Liz. Can you start in that order with the first round? Somebody in that.
Thank you, Mr. Mabaso. Good afternoon to Kenya and SABC and colleagues. And ngisho nje ukuthi kubuhlungu ukuthi asaphelelanga. We started this Helele and Unyambosi no longer with us. Kubuhlungu, may his soul rest in peace. Engicela ukubuza ukuthi mhlambe yini into edala ukuthi ngoba phela bese iyehlile lento ye COVID-19 saze sabuyela kwi-stage sokuqala and now sekuza le yesibili and ngabe yini mhlambe into engabe imbangela yalokho that umphakathi needs to know ukuthi iqwala and then okwesibili if